Hello, everyone. I'm Pam Cipriano, President of the International Council of Nurses. Good morning, good afternoon, good evening, and thank you for those who are joining us. It is my pleasure to say hello and welcome all of you, my friends and colleagues around the world, to this webinar to celebrate you on International Nurses Day. I'm delighted to have with us today our colleague, the Chief Nursing Officer of the World Health Organization, Amelia Latu Afamangu Tuipulotu, who is from the Kingdom of Tonga. She served as Tonga's Chief Nursing Officer and then became the first female Minister of Health from 2019 through 2021. We're delighted to have Amelia with us today because we know that we are strong together and together we celebrate you. I wanted to share with you just a little background of ICN's relationship with the World Health Organization. We were one of the first non-governmental organizations to be acknowledged by the World Health Organization, and we have a long history of working together. WHO has long been very supportive of nurses, and nurses have been very influential in developing the agendas of WHO. ICN was vocal a number of years ago about creating the role of the Chief Nursing Officer, and we were delighted when Dr. Tedros introduced the role in 2017, and we are delighted to have Dr. Amelia in that role now. We're very active in conversation planning and actions with the Chief Nursing Officer and her staff. And then we're also active with Human Resources for Health and many other campaigns that affect NCDs and communicable diseases and Health for All and UHC. So we're very pleased to be strong partners in that work. We're so glad you've joined us today to understand what's happening in all of the work that we're doing around the IND theme, Our Nurses, Our Future. And from ICN's perspective, what's most important is the Charter for Change that we revealed today, and you can find it on ICN's website. And this charter contains 10 policy actions that we want employers and governments to take in order to have a sustainable health system that is safe, affordable, accessible, and responsive. And you'll see that we've also included in that pronouncement, we want to be sure that nurses move from being invisible to being considered invaluable. So when we look at the Charter for Change and our IND theme, Our Nurses, Our Future, we're also stressing once again that we want to learn from the lessons of the pandemic. And so our message is clear. We need to value, protect, respect, and invest in nursing. And that's not just for the future of nursing, but it is for the future of healthcare. So we're working on your behalf to be sure that we have safe and empowering working conditions and that we gain the value, protection, respect, and investments that are needed for the future. I want to thank each and every one of you and celebrate your contributions, sacrifices, and commitment to nursing, not only for the profession, but for the people of the world. So this celebration of International Nurses Day is for you. I would next like to ask Dr. Tuipulotu to please give us her greetings as well.
Our nurses, our future. I would like to acknowledge President Pamela Cipriano of the International Council of Nurses and also Chief Executive Officer Howard Caton for your leadership for the world. Let us celebrate together our nurses, our future. The future of our profession depends on you all. Every one of you is important. Every nurse, every voice, every perspective, our collective voice of 28 million nurses is very important. I applaud the work of ICN and WHO. Nurses, I am proud of your talents, your knowledge, your passion, your compassion and care for the world's population. Today is the 203rd anniversary of Florence Nightingale's birth. For more than 2 centuries, you have cared for the world's population during the happiest, sad, and vulnerable times of our life cycle. In light of the COVID-19 pandemic, we must now translate lessons learned into health systems to ensure that nurses are better protected in any future pandemic and emergencies, and that you are better prepared and supported to respond, and that your work is respected and valued. Some of you work in the remotest contexts, sometimes on your own, where you are the only healthcare provider in vulnerable communities. We must support you better in your work through health systems, connection, and digital communication. I most sincerely thank you for your talent and your passion, for all that you do every day, every hour, and every minute in your work to provide respectful and compassionate care for everyone and our vulnerable populations in all communities. Let us celebrate making sure that at the same time that we care for you, our nurses, our carers, so that you feel and know that you are fully supported. May today's celebration continue to raise our collective voice of 28 million nurses to transform and better build for the future for all nurses around the world, supporting universal health coverage and the Sustainable Development Goals. Let us celebrate our nurses, our future, for health for all. I thank you.
Thank you so much. I know your message resonates around the world, and it's so important to know that nurses have your support and the support of the WHO. Many of the things that you mentioned are part of our Charter for Change, and we really hope that nurses everywhere will incorporate the messages about protecting the profession, making sure that we have safe and healthy working conditions, that we're looking at the mental health and support of nurses in their practice and full scope of practice, that we want to be sure that we are strengthening our education programs, that we have workforce plans that are going to address the shortages that we see, and that we are taking into account the knowledge and skills of our nurses, protecting our vulnerable populations wherever they may be, and elevating nurses to leadership positions everywhere. So thank you. So I'm going to start by asking Amelia a probing question about all of the work that she's leading and that we know is going to pay dividends around the world for nurses and midwives. So we know that the SDGs in UHC require strengthening the nursing workforce and health systems. And many of the recommendations that are in the global strategic directions for nursing and midwifery are the same solutions that will help us reach those goals. And we know they're only 7 years away in terms of the deadlines that were set for SDGs and UHC. Help us by sharing, where do you see the greatest successes thus far? Where are you seeing the best progress?
Thank you very much. For me, I see progress in all the priority policy areas of the strategic directions for nursing and midwifery, with regards to education, world-class nursing education, with regards to jobs, with regards to leadership, we just need to scale up all our investments. We need politicians, we need governments, we need health systems to escalate current investments in all those priority policy areas into the future. I have seen very recently, I hear a model of care with regards to enhancing and strengthening service delivery. And that work within member states are excellent. And I think those work with regards to model of care must be embedded within member states and to be relevant to the context. So I think overall, for me, it's we just need to scale up the current work that is currently underway within member states, but of course, seriously need political and financial commitment. Sorry, we can't hear you.
Oh, sorry. Thank you. The calling for investments is a really important part of achieving these agendas. And we know that that's challenging. And so just give us your thoughts in terms of how you believe nurses can raise their voice and provide that advocacy.
Absolutely. For me, we need to work outside the box, not the normative way that we have been doing. We need to scale and engage with politicians, engage with finance ministries, engage with potential donors, all our partners, international organizations and civil societies, so that they have a better understanding of our work, nurses' work, and the impact that our work will have with regards to universal health coverage and the Sustainable Development Goals. We really need to be able to get the strong partnership and commitment from politicians in order for us to be able to support and better support our nurses.
Great, thank you. Are there things that you would like to ask me to expand upon in terms of the work that we're doing together?
Oh, absolutely. Yes. I would like to ask you with regards to how do you see in particular nursing education for leaders of tomorrow? That has been something that I have been thinking about, the key competencies for nursing leaders of tomorrow in order to have influence at the policy table and in order to be influential to politicians and economists and finance. Thank you.
So our educators, I think, always have a very challenging job because we're wanting them to educate the current nurses that are our students for today's challenges with an eye and a foot in that future space. Mm-hmm. So when we talk about how do we make sure that we are preparing nurses to be able to meet the needs of the people that we serve, again, I believe it is one of the most challenging activities. However, I have great confidence in our educators around the world who are aggressively making sure that we are incorporating evidence from research that's being done so that we are keeping up with how practice might change. We saw very clearly in the pandemic, educators quickly incorporated technology in terms of how we could deliver education, how we could use simulation, how we could use virtual skills labs, and how we can now look at incorporating artificial intelligence into our classrooms. So I believe our educators always have a challenging job, but at the same time are doing several things. Again, technology is one, Research innovation is a second one, but also forging stronger partnerships with their clinical partners. I think that's how we maintain the currency and that knowledge of what's changing in the environment. How do we make sure that we have those strong partnerships? Because that's one of the ways that again, nurses at the bedside, on any front line in public health, they're able to identify, here's where we have difficulty, or here are some really great things that I've done. Do your students know about these? And so being able to share that information in a two-way message on a regular basis helps strengthen what faculty can then bring to the classroom. The other way that our faculty, I believe, are making great strides and are providing that stability and education for the future is their involvement in their nursing associations, because that is where the political juncture occurs, which is maybe in a school of nursing, a faculty doesn't feel like they can lobby their elected leaders, but they can join forces and be experts that provide knowledge and testimony along with their national nursing associations to be able to support the joint causes that are important to improve practice, to focus on safety, to focus on all of the working conditions and the funding of needed positions, to make sure that we're also addressing the strengthening of nursing programs, whether it's funding for more programs or funding to replace the faculty who are retiring, and really looking at other health policy. As we saw during the pandemic, nurses' voices were underutilized in terms of things like the vaccination approaches, like the infection prevention and control. So this is a great opportunity that our faculty are able to bring the real life examples to bear on what's happening in healthcare. So Amelia, oh, you're welcome. You're welcome. So tell us a little bit more about what you're hearing about nurses and their full practice scope and authority. We know that in some countries, there are efforts to restrict the practice of nurses, particularly advanced practice nurses, which is a really growing opportunity with more higher education for many of our nurses, and recognizing that that is also key to universal health coverage and expanding what we do, and recognizing that many advanced practice nurses work in the public health space, which is so important for prevention. So what's your take on what we're seeing in terms of being able to optimize the scope of practice for nurses?
I have supported in the context of Tonga, as it is very relevant, advanced nursing practice, nurse practitioner, in order to attain safe and quality care at sub-regional, rural, and remote outer islands. So advanced nursing practice, scope of practice is very, very appropriate for the Tongan context. I think there is a need, as I have said earlier on, that we raise the dialogue and engage with key leaders and key stakeholders within country, not only government, but also within the Ministry of Health and civil society, so we can advocate and raise the profile with regards to advanced nursing practice. Of course, they are the answers for universal health coverage at rural, remote, and outer islands, and for sustainable development goals. However, we know that there are challenges within some of the member states, and that work needs to be done within the member states on the ground.
Yeah, that's another area where advocacy is so important, and being able to get those conversations with all stakeholders and the different professional groups and those who are allies, as well as those who may appear as adversaries at different times. I wanted to share a quote that I will steal from someone who spoke at the recent UN high-level stakeholder meeting the other day that I was fortunate to participate in, both of the pandemic preparedness, prevention, and response, as well as universal health coverage and Stop TB. But I think this speaks to our joint work that we need to figure out the messaging around investments. And like I said, I will just steal this quote, and it is, "Only healthy children learn, and only healthy adults earn." This is the economic message that I believe we are all trying to send, which is investments in nursing and healthcare are investments in the people. When we invest in people, we have healthy communities, we have healthy workers, we have healthy economies, and that creates not only health security, but economic security. And so nurses become integral to helping our countries realize that. And we don't need to apologize for asking for these investments. So when we think about, again, what are the ways that we can also get our public on board to understand the critical role that nurses play in our public health systems, in our protections from infectious diseases, in our ability to monitor and identify those who are dealing with non-communicable diseases. When we think about all the challenges of achieving the UHC agenda, what are you hearing from all of your constituents? Because I know you have some wonderful regional chief nurses and nurse leaders who are helping send these messages. So only healthy children learn, and only healthy adults earn.
I just need to say that health is wealth. And I have always advocated that investment in nursing is not a cost, it's an investment to promote health and wealth and productivity of a country towards the future. So it is very important that we continue to raise the voice with regards to the importance of investment in nurses' work to better support our children and future adults, because they are the healthy future to drive the economy of a country.
Absolutely. And I think you actually mentioned something earlier. This is not a healthcare solution only. We need our ministers of finance. We need our business leaders. We need public and private sector, because the health of the world depends on collaboration of all of our stakeholders and all of our decision makers. So let me just ask, are there other messages that you want to share with the nurses of the world today? We've got almost 350 participants on this call, and we know many, many more will listen to the recording. Hopefully many also heard your wonderful words earlier today. And I've been seeing messages pop up from every continent, which is wonderful as well. And we know some of you have stayed up late to join in this conversation today. But what other messages do you want to make sure that we have sent in addition to our thanks?
For me, the most important message is to raise our collective 28 million voices at all levels, from government, executives, international, regional, country levels, and all the contexts within a country. We all need to raise our voices collectively, and that is power.
Absolutely.
Of course, we will raise our voice for the population, for what is good and just for our vulnerable population and for our children and their future.
Thank you so much for those words and reinforcing the word power, which we have, and we must make sure that we exercise that power to influence healthcare, to influence the decisions for funding what we need, for influencing the advances in the profession, and being sure that we don't apologize for wanting to use that power. Because again, we know that without nurses, there is no healthcare. And so we are a critical aspect of delivering health for all, achieving universal health coverage, and eventually the SDGs as well. This has been a really nice opportunity to join forces with Dr. Amelia as we think about, again, this is not just one day to celebrate nurses. Not only do we want to see the theme of International Nurses Day beckon for months and years to come, we want everyone to be thinking about the fact that now is the time for us to chart that path to the future. We need to be in charge of that. We want to see the Charter for Change, which covers all of these issues, become a living and breathing document that we use in all of our countries, in all of our national nursing associations, in order to be able to create the change that we want. We want to design our future in a way that attracts hundreds of thousands of nurses everywhere, individuals to become nurses and to keep the nurses that we have, and to be able to send that message that we are a big part of the solution for delivering the SDGs, UHC, health for all, and creating a healthier world. We know that lots of people are suffering, our world is suffering, but we also have great hope. We know that we've got the intellect and the drive and the commitment and the passion to heal our world. So I will just close with saying thank you to everyone. This is a time to celebrate the many contributions and commitment of nurses everywhere. And we look forward to being able to share more success stories and continue to instill hope and pride in everything that we do, and continue to celebrate what we know is the greatest profession on earth. So thank you for joining us today. And for those of you who put questions into the Q&A, staff will aim to provide answers to those, because we knew we would not have time to do that during this brief webinar. But thank you for joining us. Have a wonderful remainder of International Nurses Day, and we look forward to the many contributions and ways that nurses can be honored, valued, protected, invested, and making sure that all of those become a reality. Thank you all so very much. Bye-bye.